So welcome everybody for yet another meeting of Inform. And last month, December, due to holiday mood and we skipped it, and we are again back. And this time we have Professor Mohan Rajpurkar as our guest of honor. And we know that he has been into interventions from a very early time. I'm glad he is here. Welcome, sir. And we have the other chairperson is Dr. Damodar R. Kumbala from Louisiana, US. Dr. Girish introduced him to me, and I got introduced, and he will be with us sharing this session and giving his comments. So let me start with introducing Professor Rajpurkar, who doesn't really require introduction. He had his undergraduate training in Nagpur University, then finished his general medicine in Pune University. Then after doing registrarship and resident program in KEM, he had training in nephrology in Denmark as early as 1979. Then I think the greatest thing he has done is, starting an institute, Mujibai Patel Urological Hospital, Nadia, which has become a model institute. From a center of excellence, and which has become a model for both nephrology and urology. And he has had a stellar role in bringing up of that institute. He was medical director and head for nephrology for a long time, 82 to 2010. And he continues to be there. And interventions in renal angiography and angioplasty, I think he's the pioneer and to start in India. And I'm happy he is around, and I'm also going to show some of my work and trying to get some of my doubts cleared today from him. And he's a teacher and examiner for DNB, and he has got plenty of oration awards from various associations from API, ISN, ISOT, etc., and numerous publications and presentations and authorship. And to cap it all, he received a BC Roy National Award in 2007 itself. So I think getting a BC Roy Award is not a small feat. Welcome, sir. And after I introduce Dr. Damodar, and please give your opening remarks to the number of young nephrologists assembled here who have passion for interventional nephrology. Yeah. Dr. Damodar, he had his MBBS in BLDA Medical College, Bijapur. Then he went on to US doing his internship and residency in Jewish Hospital of Cincinnati, and nephrology fellowship in Tulane University School of Medicine, New Orleans. He is board certified in nephrology and internal medicine. And presently, he's intervention. He's an interventional nephrologist in Dialysis Access Institute in South Carolina. He got trained under the one and only Dr. John Ross, who is actually a vascular surgeon and pioneer in AV access creation. And he has got many clinical studies, both in cardiology and nephrology fields, and he has published extensively in various journals. I am happy he is here to share his experience, and he would be telling his comments on the discussions today. Welcome, Dr. Damodar. Then the agenda for today is Dr. Adil will be talking on lung ultrasound, and Dr. Adil is quite familiar to us. He is, I think, second or third time he is going to address our forum. He is a full-time interventional nephrologist in Khyber Medical Institute in Srinagar. And you know how difficult it is to start intervention procedures in faraway places from major institutions. And he has done a great job. He periodically conducts even workshops, and he has a lot of young fans for him, and he is going to go places, and he is keen on helping us in getting this accreditation work, and he keeps bothering me now and then, or rather pushing me to do something for this. I think we'll get it done. Then we have Dr. Venkatesh Rajkumar from Apollo Hospitals, Chennai. He finished his DM nephrology from Chandigarh PGI. And from then on, he has been somehow, I think, got hooked with intervention nephrology. He had his fellowships in various places, including Seoul, South Korea, then in Louisiana, US, then a stint in San Diego and in Japan and Singapore. And now he is a very notable intervention nephrologist in Chennai. And he is also, he's a good speaker and he has addressed us before. And before we go to the talks, I request Professor Rajpurkar to give his views on the intervention nephrology and some encouraging words for the young nephrologists here. Sir, please carry on.
Okay. Thank you, Bala, for asking me to be a part of this interesting inform forum. I've been doing interventions for for a long time. I got interested when I was doing my MD medicine. At that time, we had a renal registrar and a cardiac registrar as part of internal medicine setup. They had a cath lab more for doing catheters for valvular heart disease, which was common at that time. The coronary angios had not come to, we're just about starting. I'm talking of 72, 73. And their hemodialysis, I had an old Travenol machine, which had a central mounted coil with 100 liters. So my first intervention was to put a femoral cannula for a patient who in those days was called acute renal failure following septic abortion, with urea being 600 and a potassium was 7. And when I informed my boss, he said, what should I do? He says, what would you want to do? I said, I think we should do hemodialysis. He said, then if you know about it, go ahead and do it. So my senior registrar taught me how to. We actually had to weigh our salts and make dialysate and do it. So that is how I learned the Seldinger technique the first time. Then what happened was that my colleague in cardiology was busy courting somebody. And so I would do his caths for him. That's how I got into intervention that time. After I passed out and came to Nadiad, a small place, small center, and I didn't have an ability to employ an interventional radiologist. We started our transplant program way back in 1980, and how do I do the donor angio? So that's when I started doing donor angios. At that time, we used to do our own Quinton Scribner shunts in either the radial artery and saphenous vein at the wrist or the posterior tibial and the saphenous vein in the leg. And then we later on gradually converted it to AV fistula once the vein got developed. At that time, we didn't have central catheters, and the AV fistula shunt would develop the vein, and then once the anastomosis was done, we could go over to fistula. I didn't do fistula intervention for a long time, but got interested in renal artery work. And I said, if you have the right kind of a shape of a catheter, it's not really all that difficult. You don't really adequate imaging, right kind of a shape of a catheter, willingness to learn, and a stake in the outcome. So I learned at many places. I went to see procedures and saw them and came back and did it for my patients. Now, once you succeed, there is nobody to tell you that you should not do it. And that was the advantage of a small place. So my advice to most of you would be, if you're really interested, accreditation and all will come maybe later on, but spend time with people who are doing it, invite them to your place, keep your cases ready, get them done while holding your hands, and develop a relationship with centers which are doing it. Once you get the hang of it, it's not really all that difficult. One important thing that I would advise all of you to learn is that you must understand that no percutaneous procedure can be beforehand said to have no complications. And you must think and be prepared to deal with the complications and keep an alternative arrangement for dealing with the complications. That way, your own experience will make you better and better. Our patients need it. We have stake in their well-being, and we are interested to learn. Then don't worry too much about accreditation, because you can get accreditation and not do the procedure. That is again worthless. So go to different places, do it. I have now few of my own students who are doing interventions at other places, like Professor Valentine Lobo, who does it. Shahbaz Ahmed does it in North, and my own junior. Nowadays, I hardly have to do an intervention procedure. My colleague Hardik Patel in the department does it. I go only if I think there are problems, but my need in the intervention lab is becoming less and less in my own department. And that will happen to you also. I'm not nothing extraordinary about me doing interventions. I did it because my patients needed it. I was interested. I went to places to learn different techniques. We have published our experience of renal artery stenting for atherosclerotic renal artery disease in the seminars of nephrology. Like, for your interventions to succeed, it is very important to select your patients properly. Many of the intervention trials on renal artery haven't shown too much success to my mind, simply because they were not started with a clinical need for doing it, then doing a non-invasive method to confirm your clinical suspicion, and then doing the intervention. So ours is published in the seminars, and it's a good experience. With these few words, all of you who are interested in interventions, we would be happy to come and help you whenever you are in your own institute. We are very informal unit, though I can't promise that we will be able to give you a lot of hands-on, but come stay. We won't be able to actually pay, because that is at the moment at least not possible. But anybody who wants to observe and learn, and after a few days maybe try a hand with one of us being there, from my side, just shoot an email and we will welcome. Thank you for the opportunity, and please take over, Bala.
Thank you, sir. Thank you for that offer.